Please follow the meeting in mute mode and click on mute button when you take the floor to speak. Please use your video when you would like to take the floor during questions and answers. Please add your organization's name to the rename function. You can find the rename function by hovering over your name, and you will see the 3 dots. Behind the 3 dots, click on that and you will see more functions. Select rename and put in your affiliation. To request the floor, please use the raise hand function. And of course, you can use the chat function to put in questions as we go along. And this will be monitored and integrated during the question time. If you have any technical issues, please send a note to the audiovisual services in the chat function. Interpretation in all languages is available and can be selected in the button bar. Due to technical limitation of the platform, Arabic can currently be listened to on the Korean channel. To make an intervention in another language than the one you are listening to, you need to turn interpretation off by selecting off in the interpretation menu. And please speak slowly as usual. Please bear in mind that in a virtual meeting, audiovisual quality may deteriorate unexpectedly and become insufficient for interpretation purposes. Our interpreters will indicate this verbally and resume interpretation as soon as the sound quality permits. With this introduction, I just want to highlight that this event is being hosted by FAO and the UN Standing Committee on Nutrition. We are now ready to start the function itself, and it is my pleasure to welcome our Deputy Director General, Maria Helena Semedo, to give the opening remarks. As a little background, Ms. Semedo is FAO's Deputy Director General for Climate and Natural Resources. She is an economist and a politician from Cape Verde. Ms. Semedo is a leading expert in global issues, and she has worked in public services for over 30 years. She has received several awards and honors. Just last year, in the past 2 years, she's received several. Just to mention 1 or 2, she was the Woman of the Year in March 2018. And then in 2018, December, she received the honorific Order of Rio Branco from the Brazilian government. It is my pleasure and honor to invite Maria Helena Semedo to give us the opening remarks. The floor is yours.
Thank you very much, Anna, and thank you for your nice words. Good morning, good afternoon, good evening to all. Excellencies, ambassadors, permanent representatives, CFS Chair, United Nations System Standing Committee on Nutrition Coordinator, STINEC, ONEMA, esteemed panelists, dear participants, distinguished guests, friends, colleagues from the Rome-based agencies, ladies and gentlemen. It is my pleasure to open this online event on the 2020 Global Nutrition Report, co-convened by FAO and United Nations System Standing Committee on Nutrition. Malnutrition in all its forms is a major challenge in our society, a barrier to healthy lives and economic development. Nearly 1 in 3 people worldwide suffers from malnutrition. With increased population growth, coupled with climate change impact, this is to 1 person in 2. The COVID-19 pandemic is eroding the overall prospect for food security and nutrition. For many people, nutrition is likely to deteriorate due to the heavy socioeconomic shocks of COVID-19, particularly in places where food, health, social protection programs, and essential nutrition services are disrupted due to already vulnerable situations. In many countries, measures to suppress the spread of the virus, like physical distancing and restriction on movements, are affecting the production and transportation of high-value, labor-intensive, perishable and nutritious foods, such as fruits, vegetables, meat, milk, and other dairy products. Higher food prices, especially for fresh and nutritious foods, makes healthy foods difficult to afford, leading to poor diets and nutrient intake, and consequently increases the risk of malnutrition. To provide decision makers across the world with sound information on policy measures to keep food system alive, FAO is analyzing how the COVID-19 pandemic is affecting the food and agriculture sector. In addition to aggravating current food and nutrition problems, the pandemic is increasing inequity. COVID-19 has more severe impact on people with underlying conditions such as obesity and non-communicable diseases. It also has a higher impact on poor who don't have financial or social buffers to absorb the economic cost of the pandemic. Ladies and gentlemen, dear participants, malnutrition varies significantly among population depending on income, location, sex, age, and other factors. Growing injustice in our food system, from producers to consumers, keeps people from making healthy choices. The 2020 Global Nutrition Report looks at how tackle nutritional inequities can play a role in ending malnutrition. 2020 marks the midpoint of the UN Decade of Action on Nutrition, 2016-2025. There are only 5 years left to achieve the global nutrition and diet-related non-communicable diseases target, and 10 to realize the Sustainable Development Goals. As you could see, we have very tight schedule ahead of us. The expanding inequities in our society made more visible during the COVID-19 time is definitely a major factor holding us all back. The Global Nutrition Report highlighting inequities comes at a key moment. Indeed, next month, at the high-level political forum for SDGs, we will launch the State of Food Security and Nutrition in the World, which focus on transforming food systems for affordable, healthy, and nutritious diets to end hunger and malnutrition. We need to take action today and make sure that nutrition is the bedrock of our food system so that everyone can have access to healthy and sustainably produced diets. It is just, it is fair, and is how we can ensure that no one is left behind. I wish you all a successful event and a very lively discussion. Looking forward to your deliberations. Thank you for your attention. And again, thank you for joining us today. Over to you, Anna.
Okay. Okay, thank you very much, Maria Elena, for your words. I think you have really made a very strong point. Inequity is holding us back. Now let's hear what this inequity that was a theme for the Global Nutrition Report this year is all about. And we are really honored and privileged to have the person who would deliver this keynote presentation on the Global Nutrition Report to be Dr. Renata Misha, who is the co-chair of the Global Nutrition Report. Dr. Misha is a research associate professor at the Friedman School of Nutrition Science and Policy at Tufts University. She is a registered clinical dietitian, public health nutritionist, and epidemiologist whose research focuses on the effects of diet on health and on population strategies to improve diet. We are really privileged to have her take us through some of the findings of the Global Nutrition Report 2020. So Dr. Misha, the floor is yours.
Thank you so much for the introduction, and thank you everyone for joining us today, and likewise to the organizers for hosting such an important event. I will now share my screen so as to take you through the presentation. Hopefully everybody can see that. It is with great pleasure that I will be presenting you the 2020 Global Nutrition Report. This year's report highlights action on equity to end malnutrition. Before I take you through the key findings of this year's report, I wish to give everyone a brief overview of what the Global Nutrition Report is about. The GNR was conceived following the first Nutrition for Growth Summit in 2013 to track stakeholder commitments and inspire action. Today, it represents the world's leading independent assessment of the state of global nutrition. We provide the best available data, in-depth analysis, and expert opinion rooted in evidence to help drive action on nutrition where it's urgently needed. One of the key functions of the GNR is to track progress against the global nutrition targets and the commitments made by stakeholders worldwide to reach them. Our online commitment tracking tool provides the latest data on nutrition commitments at Nutrition for Growth summits. Given this important mandate, the GNR has a central role to play in leading and coordinating a much-needed strengthened nutrition accountability framework. This would be in partnership with other key existing accountability mechanisms to hold governments, businesses, civil society, and philanthropic organizations accountable. Strengthening global nutrition accountability is essential if we wish to inform priority setting, ensure the appropriate actions are being taken, and tackle immense nutrition-related health, economic, and environmental burdens. And now back to the 2020 report. The 2020 GNR was written before the COVID-19 pandemic, yet the key messages that come out of this report have a heightened significance in the face of this new global threat. The need for more equitable, resilient, and sustainable food and health systems has never been more urgent. COVID-19 does not treat us equally. On one hand, undernourished people have weaker immune systems that may put them at greater risk. At the same time, poor metabolic health, including obesity and diabetes, has been strongly linked to worse COVID-19 outcomes. Focusing on nutritional well-being for all is essential. COVID-19 exposes the vulnerability of our food systems. People who already suffer as a consequence of inequities, such as the poor and women, are particularly affected by the impact of containment measures, which caused food shortages. We must ensure that there is enough healthy food distributed fairly to cover basic nutrition needs, especially for the most vulnerable. COVID-19 exposes deadly healthcare disparities. Even the strongest health systems are struggling with high healthcare costs and a shortage of medical personnel, equipment, and facilities. We need to fully integrate nutrition into our health systems to to save lives and reduce healthcare spending while ensuring that no one is left behind. The way forward is through strengthened coordination, financing, and accountability. Looking beyond the present emergency, there is a need for preventive public health strategies that pay attention to food and nutrition. We must turn the challenges posed by COVID-19 into opportunities to accelerate actions needed to end malnutrition. The 2020 GNR focuses on nutritional well-being for all and highlights action on equity to end malnutrition in all its forms. Why action on equity? Because we will never end malnutrition unless everyone is treated fairly and according to need. Inequity is our defining challenge in ending malnutrition in all its forms. Most people cannot access or afford a healthy diet or quality nutrition care. This access is hindered by unjust systems and processes, holding people back from healthy diets and lives. Unfairness, injustice, and social exclusion are determined by social factors such as wealth, sociocultural perception of age, gender, and ethnicity, that in turn impact everyday living conditions. These social determinants are the root causes of nutrition inequity that can lead to unequal nutrition outcomes. For example, poorer people may not be able to afford healthy food, or such options may not even be readily available in their communities, leading to worse nutrition outcomes. This in turn can lead to more inequity, as a sickened person may be less able to work, perpetuating a vicious cycle. The consequences of nutrition inequity are evident. We live in a world where 1 in 9 people are hungry or undernourished, and 1 in 3 people are overweight or obese. Nutrition equity is our defining opportunity to fix the global nutrition crisis. Everyone deserves and should have access to healthy, affordable food and quality nutrition care, which is not simply a matter of personal choices. Governments, businesses, and civil society are accountable for healthier and more equitable food and health systems and must step up efforts. We need to remove systematic barriers and create opportunities for everyone to achieve healthy diets and healthy lives through pro-equity nutrition actions. Healthy, sustainable food should be the most accessible, affordable, and desirable choice for all. Nutrition care, preventive and curative, should be made universally available within our health systems. Now is the time to act in coordination and make nutrition central to any emergency or long-term response. So who is most affected? To answer this question, the Global Nutrition Report sheds light on the state of global nutrition and progress towards the global nutrition targets. It uses new and more granular data to go deeper and understand who is affected, where, and by what form of malnutrition. The analysis reveals that progress is too slow and deeply unfair, with global patterns hiding significant inequalities between and within countries. Looking at the maternal, infant, and young child nutrition targets on a global level, there has been some progress for exclusive breastfeeding and low birth weight. Yet accelerated improvements would be needed to reach the 2025 targets. All other targets are off course. Stunting still affects 149 million children under 5 years of age, while there are 40 million overweight children. At the same time, all diet-related non-communicable disease targets are globally off course and at alarming levels. Globally, 1.13 billion adults have raised blood pressure, almost 680 million people are obese, and 422 million people have diabetes. Overall, progress varies across countries and by form of malnutrition. No country is on course to meet all global nutrition targets being tracked, and just 8 countries are on course to meet any 4 targets. Malnutrition persists at unacceptably high levels, and intensified efforts and actions are needed to reach those targets. There are 2 sides to the global nutrition crisis we're facing: the major global impacts of food insecurity and undernutrition, which have long been recognized, and the tremendous diet-related chronic disease impacts that have more recently emerged. Looking at the global prevalence by age, gender, and over time, underweight still mostly burdens children and adolescents. Despite some improvements, it is still high, roughly 32% in boys and 26% in girls. Meanwhile, our world has transitioned to one in which more people are overweight or obese than underweight. Overweight, including obesity, is on the rise across all ages, while similar patterns are seen on a country level. We need more concentrated efforts and actions to slow down and stop the worldwide rise in overweight and obesity. The report looks further at potential inequalities in the prevalence of underweight, overweight, and obesity between countries, as determined by country income. Underweight is a persisting problem of the poorer countries. Prevalence is higher in low and lower middle income countries, both in children, adolescents, and adults, up to 10 times higher compared with wealthier countries. The reverse is seen for overweight, where prevalence is higher in high and upper middle income countries, up to 4 times higher compared with poorer countries. Likewise, obesity prevalence is higher in wealthier countries, up to 5-fold higher. The 2020 GNR finds substantial inequalities within countries and populations, influenced by factors such as location, age, gender, education, and wealth, to show that vulnerable and poorest groups are often the most affected. While the latest available data provides a snapshot of existing inequalities, repeated data show how such differences change over time. Although stunting rates have been slowly declining over time on a global scale, there are notable differences in patterns of change and inequalities by wealth. For example, in Lesotho, stunting decreased by 30 percentage points in the richest group and only by half that much in the poorest group. In other countries, such as Burundi and Nigeria, the poorest groups are left further behind. There are also cases, such as in Peru, Ghana, and Mongolia, where comparatively larger reductions are seen in the poorest groups. Despite some improvements, the wealth gap is still present, disproportionately burdening the poor and needs to be addressed. Such nutrition inequalities stress the need to make both our health systems and food systems more equitable. Let's start with our health systems. Leadership and governance form the core of a strong health system and are critical to addressing nutrition inequities through strengthened policy frameworks, oversight, and accountability. Looking at the inclusion of actions related to global nutrition targets in health sector plans by country income, we see that the focus of lower income country plans is mainly on countering undernutrition, especially through promoting exclusive breastfeeding and reducing anemia and stunting. In contrast, high-income countries focus more on overweight, obesity, and diabetes. It is important for lower-income countries to not overlook diet-related chronic diseases. Higher-income countries should also recognize the persistence of anemia and low birth weight still experienced in vulnerable populations. The low level of attention paid to breastfeeding in high-income countries is concerning, given its role as a double-duty action. Countries need to ensure that their policy instruments are fit to tackle both sides of malnutrition, particularly when these coexist. Poor diet is the #1 cause of poor health and death worldwide, with similar patterns seen in nearly all parts of the world. Burdens attributable to poor diet exceed the burdens attributable to many other major global health challenges and traditional risk factors, such as systolic blood pressure and blood cholesterol. For decades, health systems and clinicians have focused on the medical, drug treatment-based model of disease that ignores fundamental causes such as diet and lifestyle. The consequences of this narrow approach are evident: the global nutrition crisis that is now sweeping the world. Poor diets and the rapid rise of diet-related chronic diseases is putting an immense strain on health systems and the wider society. Yet nutrition care is not equitably integrated within our health systems. How do we do that? Fully integrate nutrition care into national health sector plans. Invest in human resources to increase the number of qualified nutrition professionals. Develop and align costed nutrition care plans with healthcare financing plans, scaled up and sustained to cover all forms of malnutrition. include nutrition-related health products like therapeutic foods and innovative technological solutions like digital nutrition counseling. Scale up nutrition services to prevent the root causes of ill health, including poor diets and physical inactivity. Optimize health records and checks for nutrition care, and to identify those in greatest need. Integrate nutrition in public health surveillance systems to strengthen the evidence base and inform targeted priority setting. Transforming our health systems to fully integrate nutrition is not easy, but it's an essential investment if we want to save lives and release the burden on our health systems and the wider society. Food systems have a crucial role to play in supporting healthier diets and lives. Yet most people cannot access or afford a healthy diet because of existing inequities in food systems. So how can we make our food systems more equitable? The answer to that question is complex and involves considering all elements of the food system, from production to consumption, including availability, quality, safety, accessibility, affordability, promotion, and advertising of food. As the 2020 GNR highlights, fresh food is less accessible and affordable in many parts of the world, while processed food is available, cheap, and intensively marketed. Looking at this graph, we can see that sales of processed foods are still highest in high-income countries, but are rapidly increasing in upper middle and lower income countries. The pattern is similar when we look at sugary beverages, such as soft drinks, energy drinks, and fruit nectars. Similar challenges are seen across all elements of the food system, greatly impacting the poorest and most vulnerable. Nutrition science and research has greatly evolved in the past 2 decades, enabling us to evaluate and identify cost-effective and cost-saving policy solutions. Food policies can reach broader segments of society, require less individual effort, and can be less costly compared with individual-based approaches. Such upstream strategies should benefit everyone, particularly those less privileged and of lower socioeconomic status. Here you see the cost-effectiveness plane of 3 types of taxation on sugary drinks in the US: a flat volume tax by drink volume, a tiered sugar content tax by 3 levels of sugar content, and a fixed sugar content tax by total sugar content, as compared to no tax. Health outcomes are plotted on the x-axis and costs on the y-axis. The cost-effectiveness plane is divided into 4 quadrants. When the intervention generates more health gains and lower costs compared to standard practice, then it's cost-saving, and results are shown in the bottom right quadrant. All tax structures would generate tax revenue, lower healthcare costs, and prevent cardiovascular disease events and diabetes cases. Notably, taxing on sugar content could double those gains, preventing nearly 2.5 million cases of diabetes and cardiovascular disease, and saving almost $141 billion in societal costs over a lifetime. This would also be a powerful tool to stimulate industry reformulation. Health gains were largest in young adults, racial minorities, and lower-income Americans, suggesting that such policies can help reduce health disparities. These findings have important implications for individuals, policymakers, and the food industry alike, providing evidence-based policy priorities. The COVID-19 emergency makes it critical to rethink food systems, and this presents an opportunity to shift to solutions ensuring that healthy food is the most accessible, affordable, and desirable choice for all. The 2020 GNR highlights the following specific actions. Implement strong regulatory and policy frameworks to support healthier diets, from production to consumption. Optimize agricultural subsidies and increase public investment for producing a broader range of more diverse and healthier foods. Provide support for public transport schemes and shorter supply chains for fresh food delivery products, particularly to the most nutritionally disadvantaged or harder to reach groups. Implement, monitor, and evaluate evidence-based food policies to support healthy, sustainable, and equitable diets, such as fiscal, reformulation, school and worksite-based, labeling, and marketing policies. hold the food industry accountable for producing and marketing healthier and more sustainable food products through strengthened mechanisms. Strengthen and increase research spending to address major nutrition questions, identify cost-effective solutions, and stimulate innovation. Governments, businesses, and civil society need to work together and be part of the solution, with appropriate mechanisms in place to track effectiveness, financing, and accountability. To drive the transformative change needed to achieve nutrition equity and end malnutrition, we need to be well-resourced, strongly coordinated, and accountable. But are we investing enough in nutrition? According to the projections by the Investment Framework for Nutrition shown here, more than $1 billion per year for the next 5 years would be needed to meet the global nutrition targets for stunting, anemia, exclusive breastfeeding, and wasting. Looking at the breakdown of financing by source, we can see that a substantial increase is needed in mainly domestic investments by national governments. Such investments are crucial for country ownership and long-term sustainability of programs. Although donors have increased spending, it is still not enough. Scaling up and sustaining financial commitments is urgently needed to meet the global nutrition targets. The traditional focus on undernutrition has led to obesity and overweight being largely ignored in aid allocations. Disbursements to diet-related NCD actions increased to $39.8 million in 2017 and marginally increased their share of total ODA to 0.020%. Despite some improvements, scaling up financial commitments for addressing rising diet-related NCDs in lower income settings is needed. Sectors must work in partnership to develop complementary funding and accountability mechanisms focused on directing resources and programs to the communities and people most affected by malnutrition. Critical actions include increased domestic financing covering undernutrition as well as diet-related chronic diseases, increase international nutrition financing and coordination, especially in countries with limited possibility for domestic resource mobilization. Invest in data management systems to strengthen data on financial flows, enabling alignment with national nutrition priorities. Establish support spaces for dialogue and sensitize the policy space through lobbying for community involvement, from design to evaluation. Undertake situational assessments to identify bottlenecks and remove barriers to improving nutrition. Establish a global nutrition accountability framework to hold to account those responsible for creating inequities in food and health systems. Nutritional well-being for all takes on a new urgency, given the potential for a well-nourished population to better confront chronic diseases, pandemics, and global shocks. The report makes the case for governments, businesses, and civil society to enable faster, more equitable progress towards ending malnutrition in 4 key ways. Build equitable, resilient, and sustainable food and health systems to ensure that everyone has access to healthy food and quality nutrition care. Expand financing, crucially for diet-related chronic diseases, and direct resources and programs to the communities and populations most affected. Focus on joint efforts by engaging and mobilizing all sectors to act now and target those most in need. Leverage key moments, such as the Nutrition for Growth Summit, to renew and expand commitments and strengthen accountability to monitor pledges and commitments. The COVID-19 pandemic has changed the world around us and has also made clear that good nutrition is now more important than ever. As governments, businesses, and civil society increasingly recognize the depth and breadth of the global nutrition crisis, they are compelled to act. Fixing the global nutrition crisis is a collective responsibility. Investing in nutrition, expanding commitments, and strengthening accountability has become urgent if we want to prepare our food systems and health systems for imminent shocks and preserve our future. Thank you for the attention, and I will now hand over to Anna, and I will stop sharing my screen as well.
Yes, thank you very much, Renata, Dr. Clark, Michelle, thank you so much for the presentation. Very clear. You made the points. We really need to transform not just health systems, but food systems. And this must go hand in hand because the situation affects all. You made a point that we will never end malnutrition unless everyone is treated fairly. And you gave us steps by which we can transform the food systems and critical steps by which we can transform our health systems. Thank you very much. I'm sure people will have a lot of questions for you. We really appreciate your presentation. Now, ladies and gentlemen, excellencies, I would like to go on to the next presentation, and this will be given by Stineke Unima, who is the coordinator of the UN Standing Committee on Nutrition. She has been at this post since 2016. And as such, she contributes to coherent and consistent nutrition policy, advocacy, and programming in the UN system. She is a nutritionist and an agricultural economist. She was a member of the first independent expert group. On this position, she supported the development of the Global Nutrition Report during its initial years. Ms. Unima Stineke will explore in her presentation the synergies between the Global Nutrition Report findings of 2020 that has just been presented to us, and the UN Standing Committee 2018 publication on advancing equity and equality and non-discrimination, pathways to transform the food systems. So Stineke, the floor is yours. Thank you.
Thank you so much, Anna, and also thank you to Renata for your very comprehensive and interesting presentation. I trust you can all hear me and see my screen. And I thank you very much for the opportunity to look at the synergies between the two reports, the Global Nutrition Report of 2020 and the UNSCN News of 2018, which looks at equity, equality, and non-discrimination in the food system. Of course, this public is aware of what UNSCN is and what it is all about. I just want to say we will be renamed soon into UN Nutrition, and from the mandate that was the most important thing is to remember is that we work on coherent and consistent policy, and also we look at the harmonization of concepts, and in that respect we are developing these discussion papers and also the UNSCN News, for which we select a team each and every year. The theme for 2018 was equity, inequality, and discrimination in the food system. So let's also remind ourselves that we are still living under the UN Decade of Action on Nutrition from 2016 to 2025. Why I'm mentioning this? Of course, obviously, the aim of the decade is to accelerate the implementation of the ICN2 commitments, the commitments from the second international conference, and the diet-related non-communicable disease targets. Those were presented by Renata Micha in the previous presentation. And of course, the decade contributes to the realization of the 2030 agenda. And that one is in fact all about equity and equality. Leave no one behind. We of course know the second sustainable development goal number 2, end hunger and achieve food security and eliminate all forms of malnutrition. But I also want to remind ourselves there is SDG number 10, which is reduce inequality within and among countries. So the malnutrition challenge, of course, the numbers were there. Renata presented them in a very well way. I just want to remind us 1 out of 3 people is malnourished. Each and every country is affected, but this does not mean by Renata. So there is, even the little progress that is there is uneven between countries and among population groups of malnutrition. Of course, they are there in the daily living conditions, in unequal access to water, sanitation, education, etc. But when you delve deeper, you can look at production systems that are not delivering healthy diets. But basically, delving deeper even, it's basically about the denial of the right to food and health. And that denial drives many of the characteristics of human societies and their interactions, as well as the underlying norms, values, policies, institutions, and processes at local, national, and global levels. Power is very much inherent to these power and power structures is very inherent to these issues, and a power analysis does help sometimes to really pinpoint to where we should be looking at to solve these inequalities in the systems. So all these elements together made us, UNSCN and its members, select the issue for this UNSCN publication. So the next slide is should be very familiar to all of you. It's the HLPE Food Systems Framework. And this framework is very helpful to really look at all the elements of the food systems, and also where inequality can enter and is related to elements of the food of education that also has an impact on consumer behavior. So throughout the food system, we see these inequalities. Renata didn't present it, but this framework is basically the same, but it's published this year in the Global Nutrition Report, and it is an extract from the HLPE system, food system framework I just showed you. And again, you can see the elements where inequity and inequality enter into the system. Very often inequality of research and income are often considered to be among the primary causes of malnutrition. But these economic inequalities are often the result of other inequalities affecting the food system. Social inequalities, unequal access to resources, spatial inequalities, inequalities of power, education and health, and gender inequalities. Income is very often one of the major underlying causes of malnutrition. It often has to do with access to basic resources like education, like water and sanitation, as I mentioned before. But of course, we know that a good income is not always, is very often not, it does not very often equal to good nutrition. So we have to look at the other basic determinants of nutrition as well. Gender inequality, it's an extremely important one that we see throughout the entire system, and it very often has to do with intersecting inequalities throughout the system. Then we see geographical or spatial inequalities, where you sometimes see that groups that live together or that are together in a specific area face discrimination of where they are. As mentioned just now, I mentioned cities, rural areas, but within cities you sometimes see these food swamps or food deserts. Then we see ethnicity, unequal elements related to ethnicity. And that, again, like sometimes gender, very often has to do with intersectional inequalities, many forms of inequalities that come together in one group and that prevent them in the end to enjoy a good health or nutritional status. Power, as I mentioned before, many of these elements have to do with unequal power balances. So it does help, as I said, to do a power analysis to really pinpoint where to start changing these systems and these inequalities in the system. I've been mentioning the words inequities and inequalities a little bit interchangeably, and I hear that many people do that, but there is a difference there. So let me explain a bit the difference between inequality and inequity. Inequality refers to differences, variations, disparities in the living conditions of individuals and groups, whereas inequity adds a moral dimension to the situation, referring to the process by which certain results are produced, and to the way in which wealth is distributed, and to how needs are assessed and addressed. And then we also have these intersecting inequalities. I pinpointed already to those related to gender, ethnicity, etc., etc. So that is in fact a combination of multiple disadvantages that can affect certain groups of people and focuses on opportunities rather than outcomes. And especially these intersecting inequalities lead to the lock-in of inequality in the system and the challenge to address them. We see now the result of this. 1 out of 3 people in this world is malnourished, in combination with many environmental problems, biodiversity deterioration, and socioeconomic consequences. So what is needed here? That we really seriously look at the realization of the right to food. And we have voluntary guidelines on the right to food published in 2005, pointing out that such a that a right-based approach should take into account the need for emphasis on poor and vulnerable people who are often excluded from the processes that determine policies to promote food security, and the need for inclusive society free from discrimination by the state in meeting their obligations to promote and respect human rights. Now focusing on the UNSCN News 43, Advancing Equity, Equality and Non-Discrimination in the Food Systems. Basically, it says, and both the GNR and the UNSCN News state, that poor diets are not simply a matter of personal choices. It's not just the individual who chooses what to buy, grow, or eat. Often it's the food system that plays a decisive role in creating an enabling environment. So the articles in this UNSCN publication provide a systematic analysis of the food system dynamics while identifying problems, but also solutions that lie in the hands of both politicians and social actors. The articles mention persistence of inequalities, multi-sectoral approach to malnutrition, power concentration in the food chain, production methods to support healthy diets, food environment for healthy food choices, address equity in nutrition research, and the right to food to address systematic causes of malnutrition. So I have listed those challenges that I just mentioned again, and listed also the opportunities next to them, because there are opportunities and we could be changing the system, but we have to focus on participation and inclusiveness. We have to improve governance and accountability. We have to take a food system approach, so all sectors, all actors. We have to look at production systems to increase diversity, sustainability, for example, through agroecological methods, human rights, right to food, and we need to apply an equity lens to nutrition research. And I believe that the Global Nutrition Report that did provide that equity lens to nutrition has been a very good step forward. A snapshot of our, sorry about that, a snapshot of some of the articles in the UNSCN news. Advancing Equity, Equality and Non-Discrimination in the Food Systems, Pathways to Reform. So in an article by Dr. Rocha, we see the political economies as gears to unlock healthy and sustainable food systems. The challenges to do so is that in fact still there is an evidence gap and a bias in understanding the health issues. we also see often that nutrition is still framed as a matter of nutrients instead of diets and food environments and food systems. And we also see the challenge of the influence of the food industry in shaping the conversation. Another article looks at the food environments that help shape positive food choices and lifestyles. And evidence in the article suggests that effective approaches to reduce the level of overweight and obesity involve tackling the issue of geographical proximity, financial income, as mentioned before, and informational access simultaneously. Again, a right-based approach ensures that everyone has access to food with dignity. Finally, approaches to equity in nutrition research. When we look at concepts like marginalization, intersectionality, and power relations, this can help to start understanding how nutritional inequalities develop and become intergenerationally entrenched, and how inequity can be tackled at the source. And this needs to be a first step in order to be able to tackle these lock-ins in the food system. For some reason, I didn't manage to flip the slides, but I did now. So to end on a positive tone, both the UNSCN News and the Global Nutrition Report state we should address inequities in food systems and make healthy, sustainable food the most accessible and affordable choice for all. And UNSCN News, if we are able to ensure equal access to nutrition, to nutritious and adequate diets, we have to simultaneously tackle interlinked challenges at the individual, household, community, country, regional, and global levels. So the opportunities we saw in the food system, in the articles, lie in a food system approach. There is currently a better understanding of interconnectedness. We see there is a lot of attention to biodiversity, climate. That's the downside of sharing your screen. You see all my pop-ups. There is a lot of understanding of the interconnectedness of all these elements. There's biodiversity issues, climate, push for the climate, a push for uniform marketing, health, etc. But because there is overall a better understanding of this, there's also a move that food movements are more integrated. There are new alliances, and this creates opportunities to shift the power balance. And we see participation and accountability at global and local level. So finally, that's my final slide. We need to transform the food system. We can build equitable, resilient, and sustainable food and health systems in which all people can enjoy the right to food and have access to a healthy diet. And we do have the political momentum at this moment. Many people in this room, in this virtual room, work on the CFS voluntary guidelines for food systems and nutrition. And these should ensure the progressive realization of the right to adequate food in the context of national food security. And this CFS basically has all the elements that are needed in order to transform the food system into a more equitable one. It is participatory, it's inclusive, it's multi-stakeholder, and it's multi-sectoral. Then next year we will have the Food System Summit. And basically this would bring together this topic of transforming food systems at the highest political level with the backup of the Secretary General of the United Nations. So I do think we have a good momentum these days, and let's work with it, and let's start transforming the food systems for more healthy, more sustainable diets and good nutrition for all. Thank you so much. Over to you, Anna.
Okay. Great. You may stop sharing your screen, Steneke. But thank you very much, Steneke, for the presentation. And I note the harmony, in terms of the messages between the two it's very, very clear we need to transform our food systems, but inequity is an underlying thing we need to address. And this message has come out very clearly in both Renetta's presentation by the Global Nutrition Report and also from your presentation. Thank you so much. Now, ladies and gentlemen, we'll now go to another segment. We have identified for you some distinguished panelists who address specific aspects of what we have talked about. And it is my pleasure to invite our three panelists who will talk to us. The first will be His Excellency, Mr. Tanawat Tiesien, who is the permanent representative of Thailand to the UN agencies in Rome. And he is currently the chair of CFS, the Committee on World Food Security. He was elected as chair of CFS in October 2019 for a second term, for a 2-year term. And other speaker will be Ms. Lauren Landis, who is the Director of Nutrition for World Food Program. Ms. Landis spent her career working in the field of relief and development. She began in 1985 with OCHA in Geneva, and she has been the Director for World Food Program in Geneva office and has served as WFP country representative and director in Chad. Then our third panelist will be Joyce Njoro, who works with IFAD as the lead technical specialist for nutrition and social inclusion. She leads efforts in mainstreaming nutrition in IFAD's operation and non-ending activities such as policy engagement, capacity building, and knowledge management. Ms. Njoro has extensive experience in multi-sectoral nutrition governance, designing frameworks and policies, and multi-sectoral coordination. The objective of this panel discussion will be to get the perspectives of CFS, WFP, and IFAD on the theme of equity and inequality in nutrition and in their organizations. So I'd like to kick off this discussion. We have our three panelists with us. I'd like to kick off the discussion first with our ambassador. So a question to them would be here, basically each of them will give us their perspective of equity and inequity in nutrition and how their organizations are addressing this. So Ambassador, the floor is yours.
Thank you very much. Very good morning, Excellencies, dear colleagues, ladies and gentlemen. First of all, I would like to express my appreciation for the organizer for inviting the Committee on World Food Security, CFS, to be here and also to discuss with you with other two panelists. As you have heard from our speakers, the Global Nutrition Report has given us inside information where progress has been made and what the challenges still remain. The new analysis on the status of nutrition in the world shows that the global and national averages hide significant inequalities within countries and populations, with the most vulnerable groups being most affected. And also the Global Nutrition Report mirrors closely what the CFS High-Level Panel Expert Report number 13, if you can recall, on nutrition and food system brought to light. And it just last week, when we launched the High-Level Panel of Expert Report number 15, on building a global narrative toward 2030, the report also addressed to the issue of inequalities, which actually we know that this issue is very important and relevant with the situation. And the COVID-19 pandemic this year has made the situation of food securities and nutrition even worse. The COVID-19 does not treat us equally and further expose deadly disparities. And the COVID-19 also deepens level of inequalities, as all of you know. And the situation or the pandemics exposed the vulnerabilities and weaknesses of our fragile food system, which actually are Anna and also other speakers already mentioned that we need to transform our food system. And that's why we also address to those issues. At CFS, our collective way forward is to strengthen the global multi-stakeholder coordination, policy convergence, and more financings and national accountabilities. And currently, the CFS is preparing the voluntary guideline on food system for and nutrition, as Seneke already mentioned. The objective of this voluntary guideline is to contribute to promoting sustainable food system to ensure that the food that contribute to healthy diets is available, affordable, accessible, safe, and of adequate qualities and quantities. And we need to have a clear focus on respect for human rights, especially the right to adequate food. At CFS, I think all of you know that after the CFS reform in 2009, the CFS is intergovernmental and multi-stakeholders platform. And the CFS aim at reducing inequalities by giving voice to the most vulnerable and food insecure. And that's why after the reform, we also include private sectors, civil societies, and also constituencies to represent consumers, farmers, producers, to make sure that they can echo their voice on these particular issues on food securities and nutrition. And as I mentioned about the voluntary guideline on food system and nutrition, this guideline call for strengthening governance and accountability mechanisms to ensure citizens' participation in national debates on food securities and nutrition, and on food system and transparent and inclusive decision-making process based on transparent rule of engagement. And now CFS, during let's say according to the CFS multi-year program of work, MyPow 2020 to 2023, the CFS approved from the previous CFS 46, CFS approved a work stream on reducing inequalities for improving food securities and nutrition, which will be informed by the report of HLPE on this subject. And also another work stream on gender equalities and women empowerment is another work stream that we are working to make sure that we can address the issues of inequalities on food securities and nutrition. And if you look back from 2009, since the CFS reform, several products and policies, I can give you an example like the voluntary guideline on responsible governance on tenure of land, or even the principles for responsible investment in agriculture and food system, and another products on framework for actions for food securities and nutrition in protracted crisis. all of these products is really addressed to the issues of inequalities. And lastly, it is absolutely critical that FAO and also others UN agencies and all stakeholders make a clear and unambiguous commitment along with all CFS members and stakeholders to actively champion the uptake or implementation of the voluntary guideline on food system and nutrition that we expect to finalize next within these years, and also will bring to get approval during the next plenaries CFS 47. And I would like to emphasize that together we can ensure food securities and nutrition for all. Thank you very much.
Yeah, thank you very much, CFS Chair. Thank you so much for updating us on the objectives of the voluntary guidelines and also on the other CFS work stream. Thank you. We'll go on to the next panelist, Lauren Landers, the Director of Nutrition at WFP. You have 5 minutes, please.
Good morning still, and thank you, distinguished colleagues. Thank you for inviting me to speak today. I think so much has been said, so maybe I can just add in a couple of points that really build on this concept that Renata was talking about in terms of nutrition equity. What we've really been asking ourselves at WFP are, what are the pro-equity solutions in this COVID crisis? How do we improve the access and the consumption of healthy diets during COVID? What is it that we can do in our promoting policies and programs that can really get at how to not end, but how to lessen these inequities? Because so far, in COVID, we see that the poor just keep getting poorer and the hungry just keep getting hungrier. So how can we mitigate? And one of the things that we've been looking at is, how do we focus, really narrow in on the cost and affordability of a healthy diet? And then what are the actions that we can take to promote food policy and field programs that will help to mitigate this? So one of the things, I don't know if maybe in 2018, I'm just going to give an example real quick to give you an idea. In 2018, several of our distinguished colleagues who were in the WFP board will remember a publication called Counting the Beans. And it was basically a study and analysis that looked at the cost of food, the cost of a bean stew in various different countries. And what we found is the results were actually quite amazing. We found that in New York City, someone would spend, say, 0.6% of their daily diet on this bean stew. But whereas in Southern Sudan, it was about 200% of their daily income. And maybe in Nigeria, it cost $200. And in Congo, it was $79. Same plate of stew. So in other words, can we do the analysis to figure out what it costs just to get a basic meal with all your basic nutrients in there? And how does in most places, healthy food just about unaffordable, and household purchasing power has been going down, and therefore the cost of a healthy diet has been going up by about 7 to 11% in those countries already, as we see in this crisis. As we know, this crisis is a marathon, not a sprint. And so we can't just look at a point in time. And what we're really going to look at, as so many people have been saying today, is the food systems over time. So we're really thinking about, what do we have this Fill the Nutrient Gap tool. We've done it in about 22 countries. And now we're taking the new data that comes in as a result of COVID and looking at the impact on what a healthy diet costs and what are the detriments, what are the obstacles to getting that healthy diet. And our COVID response has got to come in and start to focus on any of those things that we could do to try and close that gap. So we're looking at it so much right now in a country by country basis. But I guess what I'd like to end today and connect to the Global Nutrition Report is, boy, can you think about the world where we could take that global? Wouldn't it be great if we had the monitoring and analysis to really standardize and unify and really understand what that cost of a healthy diet would be around the world in the different South Sudans, the DRCs? And what if we could use that knowledge to really help us move policy, encourage governments, and implement programs in a way that could help decrease those inequities and improve the access to a healthy diet? So just some thoughts for today. Thank you very much.
Thank you, Lauren, for letting us know what WFP is doing, and especially closing the nutrient gap. And I like the fact that we need to factor in the influence of COVID. I mean, now we cannot run away from it. It's here, we have to work around it and move on. Thank you very much for your presentation. Now let's go on to our next panelist, who is Joyce Njoro, who is the Senior Nutrition Specialist at IFAD. Joyce, the floor is yours.
Thank you very much, Anna. And thank you also to all the previous speakers. I think there is no doubt now we see from the Global Nutrition Report, we can definitely see that equity is a major issue that needs to be addressed. And equity is not only geographical, but then there are many other factors that predispose communities to inequity when it comes to nutrition. So this is very clear, and it is very much aligned with what IFAD is doing. And when we talk about pro-equity at the International Fund for Agricultural Development, this really also implies aligning its work with the 2030 Agenda for the Sustainable Development and leaving no one behind principle, no one behind. Because the question always asks, like, it takes a lot of effort not to leave anyone behind. And the instruments, and how do you ensure that you're really targeting those who really need this support? Because usually when we have national prevalences, they mask a lot of other inequities, like we have just seen. But then it takes a lot of effort and instruments to really see who is it that we need to reach out to, and who really needs this support when it comes to investments on nutrition, and what type of vulnerabilities are they suffering from, and what needs really to be done to address some of these issues. And these are some of the questions we've been asking ourselves at IFAD, and seeing how can our investments at IFAD also contribute better to nutrition, and how do we also make sure that we reach the most vulnerable, and understanding that it's looking at it not only from a silo approach, but really from a multi-sector approach, because agriculture alone is important in providing the food, but then we need to have all the other sectors around the table and have a dialogue on to ensure that we really address the nutritional gaps. And as it was clearly mentioned, that we need to look at beyond undernutrition or overnutrition, but looking at all forms of malnutrition. So basically, when it comes to what IFAD is doing, it's really working with the smallholder farmers mainly, and the rural people, and to address issues on poverty, achieving food security, and also nutrition, and at the same time also sustainability and resilient livelihoods. And it is very clear then who are these who are likely to be socially excluded. And the target groups for IFAD reflect the intersecting inequalities that have just been mentioned, that make really the pathway out of poverty as well as food and nutrition security particularly steep. And this is especially for disadvantaged groups such as the indigenous populations, ethnic minorities, women, youth, persons with disabilities, and not forgetting we have the smallholder farmers herders, pastoralists, and fisher folks. And all these have different needs and different requirements when it comes to when you think about programming. So how do you ensure that really that the instruments and the interventions reach the right people? So what we are learning is the need to have a systematic and multidimensional analysis to really understand what are the underlying issues. When you talk about inequities, what is really causing these inequities? What are these vulnerabilities? Are they related to socioeconomic and livelihood status? Are they as a result of food insecurity? Is it environmental degradation and climate vulnerability? Is it in how the people are coping to shocks? Or is it just agricultural and an income generating activity potential? So this really helps us to see then, in that case, then what type of interventions do we need to select? Maybe multi-sector intervention that would address the nutritional problems of these beneficiaries. And the interventions would vary, and many of them are diet related. And this includes like selecting highly nutritious women-dominated and employment-generating crops for value chain development efforts, and by investing in processing and value addition. And I think this has come out very clearly as one of the ways to go. Then also having nutrition support packages for vulnerable groups such as pregnant and lactating women. And this will help either in care practices, in also self-care for maternal nutrition, and this may include home gardens, nutrition education, and others. Then also empowering women and youth economically and socially. And this is in different forms. So it could be even just having a voice and being able to make a decision. We are now talking about making choices for food choices. But then how do you make the choice for your diet? Many times these choices are made for us. People don't really make the choices. Either the food environment makes the choice for you, or the choices are happening at the household level. And then of course, not forgetting the role of biodiversity, because this is really where our food is coming from, and we need to maintain and promote that and safeguard that as much as possible. Then in terms of when it comes to really like targeting, is really thinking about what are the most appropriate methods that we can use to reach these vulnerable groups. Like for example, just having appropriate technologies that will apply for women and youth, or even indigenous peoples, because there's no one type of technology fits all that we can use. And then thinking about community-based approaches and learning by doing methodologies, and that can help engage people and also reach out to others who are hidden. Like young girls may not be visible in the rural households because we don't see them. Usually when a girl, for example, gets married, even if they're young, they automatically become women. So they may not be visible. So you need instruments that help you to reach out to this. Also the cultural sensitivity, and so applying different methods that are aligned to the culture of the different groups that we are working with. And I think all these factors and being able to see then when it comes to monitoring, then are we still tracking and working with the vulnerable groups? Are we changing their status from the baseline and as progressively as we work on the project? Because this is really very important, because if we are not tracking that, then it is very hard to know where we are going. Then finally, I'll say that for IFAD also, there has made several commitments towards ensuring that we have this a food systems approach, and that most of these core issues that look at the risks and vulnerabilities are systematically addressed in IFAD's investments. And some of these, for example, the latest commitments that were made in 2019 to 2021 is that 50% of investments in agriculture and food systems will be nutrition sensitive. So they must have a nutritional impact or outcome from the investment. Then 50% of these investments also create employment opportunities for youth, and 25% of the investments address underlying issues that really social and cultural that prevent the women from achieving from really achieving their agency. And this may include work overload, policy issues, or other systematic issues or cultural issues. And then finally, that at least 25% of IFAD's program of loans and grants will address climate and resilience. because we know even when we do everything we have to do, then we have the risks of climate, then whatever it is that we are building might be eroded. So I think I'll stop here for now, and then maybe we'll get to discuss further in the program.
Yes.
Thank you, Anna.
Yeah, thank you very much, Joyce, for updating us on how IFAD is building equity in its investments. I think one of the things you mentioned is the fact that if we really want to leave no one behind, we really have to look for these vulnerable in the household, have no voice, are not seen. We have to look for them and address their need. Thank you so much for updating us. Now we will go on to another exciting session, which is the question time. I see 1 or 2 questions being posted, but you have the opportunity to be heard, to present your questions to everybody. And please just do that by using the raise hand option. If you do that, we'll see your hand and then I'll call you. I know some have already asked questions. If they like, I can call them to start. I've seen an exciting question from Hungary. I don't know if he's still on and would like to take this question for everyone. So we have a few minutes, some minutes for questions.
Thank you. Can you hear me?
Yes, we can.
This is Zoltán Kálmán speaking, the Hungarian permanent representative to the Rome-based UN agencies.
Okay.
See you even if only through a video in a virtual session. I sent some messages in the chat box, but wanted to start by appreciating of hosting this event and organizing it. I think it is a very great idea and relevant, and congratulate all the presenters, in particular Renata for the excellent presentation, but all other contributions were great. I just made comments with regard to the need for considering the so-called externalities, the indirect, sometimes hidden costs or impacts of the various food systems as a result of this ignoring this consideration of this indirect costs. The low quality food, the junk food, is priced low and is available for the poor. As a consequence, they eat, many of them eat and can afford. This is an affordability issue. Can afford only to have low quality junk food. Why the true cost accounting, when we consider all the positive and negative externalities of all the environmental and public health and all the externalities, then would result in a more appropriate pricing, including competitive prices for the fresh, locally produced food and vegetables. And affordability should not be depending only on the price. Affordability is a question and should be the consequence of the appropriate food system. And as Pope Francis said, the poor people do not need charity, they need dignity. And dignity means a dignified possibility to work and dignified livelihood. And as a result, they would afford also the healthy food. And one more issue that I wanted to also consider now is the food policies. We agree that we would need appropriate policy incentives to encourage the stakeholders, various players in the food system to behave according to our desires. In this regard, Renata mentioned the taxing and so on. And I wanted also only to draw attention to the fact that according to the OECD report, only in 1 year, 2019, $700 billion spent on subsidies. So the money is there. Money is spent for subsidies. What we need is to redirect subsidies to incentivize the healthy food, the healthy nutrition, and healthy food systems, and disincentivize or disencourage the inappropriate, what we don't want, taxing and all of these other things. Congratulations again, and I really hope that this global nutrition report will have a role and to play and contribute to the constructive discussion of the finalization of the voluntary guidelines on food system in the framework of the CFS. Thank you, and over.
Okay, thank you very much, Ambassador. I've seen two other hands. Let's take these questions, and then I'll open the floor to our panelists to, address various aspects of the question. So the next is Ambassador Hoogeveen, and then when he finishes it, we will have Israel. Elliot Berry will follow him. So Ambassador, the floor is yours.
Thank you very much. And first of all, my sincere compliments for the excellent presentation of this morning, and even more, of course, our compliments for the excellent report. And of course, as chair of the open-ended working group on the voluntary guidelines for food systems and nutrition, I think this report gives us a strong basis for hopefully finalizing our work this next half year. For me, it's very important, and what we see in the international discussions, both, I would say, in Rome, but also in New York and perhaps Geneva, is how to work with clear definitions. For example, we speak about healthy diets, but we still don't have an internationally agreed, I would say, definition what healthy diet is. And of course, we always have a very strong decision about sustainable healthy diets. But I think what we actually mean is that, first of all, we need sustainable food systems, which can help us to produce food for healthy diets. But how to overcome this, I would say, deadlock in discussions, international discussions, because we need UN agreed language on it. Otherwise, we are divided amongst concepts and we never go into the substance. But I think your report will give a strong input in the negotiations and in discussion, and certainly it will help us to find solutions for outstanding issues. Then I very much support what was said by my dear colleague Sultan about prices. And I think it's very important that we work on scientific-based and fact-based concepts. And I think for setting the prices, the real prices, and including, for example, environmental and other costs or social costs, I think until now I didn't see any study or scientific approach where we can get to through pricing for everything there is. And if that's not the case, it will be very difficult to introduce such a concept, fair pricing, whatever we call it, into any UN agreement on improving nutrition. And because that's the overall goal, we have to work jointly together. We have to make a success of the voluntary guidelines for food systems, as well as nutrition, and especially to give a strong input in the World Food System Summit next year. Thank you so much.
Okay, thank you very much, Ambassador. We will now take the third hand, that's from Elliot Berry. Please, the floor is yours.
Thank you very much, Professor Lati. I think you have conducted this meeting excellently, as have been all the presentations. And the Global Nutrition Report is definitely going to be a milestone on how to continue, and especially with the emphasis from Stineka on equity and equality. My point that I would like to see, that if we're going to tackle in particular obesity, we haven't mentioned enough the importance of school education from kindergarten to the end. If we're going to make lifestyle changes, we have to work in the schools, and I'd like to see more emphasis on that. Thank you.
Okay, thank you very much. I don't see any hand yet, so I'm going to give the floor to the panelists. Maybe Renata, since several of the questions address your presentation, I will give you the floor, and then maybe others, Seneke, if you have anything to add. And some are mentioning about the true cost of fair pricing, how it plays into all of these things. Issues about definitions came up, and also the importance of schools. So I give you the floor, Renata, if you want to address any.
Yes, thank you. These were all excellent remarks and points that each and every one of us should keep into consideration, especially, I guess, as policymakers, as considering different options. So as it was included in our analysis in the 2020 GNR, it was also part of the presentation. We obviously, due to the time constraints, we couldn't go into further discussions, but the 2020 GNR does highlight that processed food is available cheap and intensively marketed, and that the sales are rapidly increasing. And in contrast, the healthy food is less affordable and less accessible, and that has only been made worse with the current pandemic. Also, in terms of policy solutions, as new evidence comes in and as the nutrition science evolves, and as I mentioned, it has greatly evolved over the past 2 decades, enabling us to evaluate and identify cost-effective and cost-saving solutions. Food pricing is one of them that captures both taxes and subsidies to try to reflect the real cost of food to the society and to everybody. They are complementary. It can also be complementary tax and subsidy scheme. There are also other strategies, from food labeling to food reformulation to school-based interventions, as it was mentioned, from school gardens to education to banning unhealthy foods and beverages at schools, to marketing campaigns, counter-advertising, banning unhealthy food advertising to children. There's so many different policy solutions that are coming up as part of research and science. So it is important to not forget more spending for research and to be able to identify those cost-effective and cost-saving solutions. So what is a healthy diet? I guess this is a burning question and one that has been also a point of confusion amongst agencies and also amongst people. Initially, and that's how the guidelines were, the dietary guidelines were developed, it was a single focus on a nutrient, one disease. We have obviously greatly evolved since then, and we now understand that it takes a whole diet to influence our nutritional status and obviously the potential for chronic diseases. They are again informed by science and evidence and mainly nutritional epidemiology. We now have the tools to identify what constitutes a healthy diet and healthy diet patterns. There is not a uniform definition, I agree, but we do understand that it's mainly fruits, vegetables, whole grains, nuts and seeds, healthy protein-based sources, and obviously the unhealthy counterparts, which is the junk food, the highly processed food, anything that is rich in sugar, added sugar, salt, and unhealthy fats. So I guess such efforts can be made into coming up with a uniform definition. And to end, I guess, with the school education and more emphasis in any school-based interventions, I fully agree with that. And also the early ages is a critical period to establish lifelong eating habits. So this is the right time to intervene and ensure that younger people understand what it takes and what it means to incorporate, I guess, and follow a healthy diet through interventions, because we need to remember and remind ourselves that, and I think all of the panelists agreed on that this is not simply a matter of personal choices, and we need to transform the food systems. Thank you.
Okay, thank you very much. Stineke, maybe based on a lot of the reports that UNSCN has put out, would you want to add to what has been said here around the fair pricing of food and the definitions and importance of schools?
Yeah, just maybe 1 or 2 sentences on each. Regarding the fair prices, I think it's very important to, as was highlighted in Renata's presentation, to really invest in good research, public research that helps to move away from the monotonous food production system we have now, because now we are focusing on these main staples, wheat, rice, and a few others that basically determine our diet. So products based on these crops are cheaper than the more nutritious ones that were just listed by Renata, like the fruits and vegetables, the nuts and the pulses. There's less investment in those, contributing to a price bias, in fact, towards less nutritious products. So more research, more investment in public research should help there. Regarding to the school question and the adolescent question, I think it's a very good comment, and investing in our kids, our children, our adolescents, in fact, is a double, if not triple duty action. It helps indeed shape the good dietary habits now, but also help shape dietary habits in future, and also the children that will be the children of these children. And then again, schools are interesting in themselves. You could look at schools as systems, food systems, mini food systems, especially if you would have school-based interventions that combine school meals, homegrown school meals that have a roll-on impact on the surrounding economics, providing income for small-scale farmers, and then again, closely link sustainable production with the consumption of healthy products. So there is a huge potential if we would really look at schools as a system to improve nutrition, combining the various sectors. And then one sentence related to the question of Ambassador Hogeveen. Yes, we need a unified definition for healthy diets. And do know that UNSCN, we are organizing meetings among the UN agencies to try and prepare such a definition that could be used in the upcoming CFS negotiations and conversations. Thank you so much, Anna.
Okay, you're welcome. Now I give the floor to the CFS chair.
Yep, thank you very much. I think I really appreciate for the comments and remarks made by colleagues from our ambassadors of Hungary, Netherlands, and also colleagues from Israel. We know that to build good eating habit, we have to start from home. We have to start at school. And all of us know that we are what we eat. And that's why in order to promote a good eating habit, we need a real action. Because now I think we talk a lot about the policies, we have the clear policies, we have a clear guideline, but how we can translate all the policies and guidelines into action at the ground level, at the country level, to make sure that food education it really delivers at school, and also we can promote a good eating habit to all means that we have, to ensure that people get our information. And as Sultan mentioned about the price, we know that people try to buy cheaper food. But anyway, if we can encourage them and also give them more information, for the long term, we may be able to change the behaviors and also the habit of people. And people would think carefully, because let's say once they know more information, they are well aware what they eat. They know that the impact afterwards. Once they get obesities, once they have any kind of malnutrition, what is the consequences, health consequences afterwards. That's why I think these issues, we really need to bring all the policy into actions. And as mentioned by Ambassador Hogeveen, and also in his capacity as a chair of open-ended working group on voluntary guideline on food system and nutrition, we also now we are discussing about the agri language. And that's why during the next 6 months, 5 or 6 months, the Ambassador Hukuin, together with the members and also with other stakeholders, we work continuously and also work harder to make sure that we can have an agreed language, whatever in terms of healthy diet or sustainable healthy diet, to make sure that we can transform to help sustainable and also resilient food system, to make sure that we can address the issues of nutrition and malnutrition in all forms. And I think I over back to you. Yeah, Anna. Yeah.
Okay, thank you very much, CFS Chair. Thank you so much. I don't see any hand, but I'll ask if the panelists want to say briefly, not more than 30 seconds so that I can round up, because I'm keeping an eye on the time. So 30 seconds for each panelist. Yeah, Lauren.
Sure, Anna, very quickly. On pricing, I've had many dialogues with Ambassador Zoltan on this issue. And I guess the nicest thing I can say is that, as many of you know, I'm headed to Kenya. And Kenya is where we do a lot of retail engagement and trying to increase the availability of nutritious food at reasonable prices. So all I can say is come see Kenya, and I'll see if we can do one study. I'm sure there are many others that can really try and build the local evidence that maybe can, in the end, create the broader evidence that our ambassador from the Netherlands is looking for in terms of guiding us in the broader policy. Last point, it's all been said, in addition to homegrown school feeding, it's just important to point out that it's really, what we're really working on is making sure that every school meal that's served is nutritious. Both FAO and WFP work very hard on this. And that in that school, we also do a lot of nutrition education to make sure that we build that lifetime of knowledge about a healthy diet, as so many people have said. Thank you.
Thank you. That was a long 30 seconds. But before we go to the others, let me give the floor to Malaysia. Malaysia, please be brief. We have a hard stop time. So Malaysia, the floor is yours.
Yeah, just to congratulate you on the well done report of the nutrition today. Thank all the presenters. Just a quick point in terms of the concept of traditional foods. I think we need to also look into what traditional food, how we define traditional food. Most countries have their own food, which is intrinsically for the country itself. I think it's important that we also realize, that we need to also refine how we approach traditional foods, because in most countries at the school level and even at the community level, this is something that is very important to them. So, and I agree with Ambassador Hans that the definition of food should be clearly identified, and also to include the role of how traditional food plays into this whole spectrum. So thank you once again, excellent. I really enjoyed the session, and good luck to all of you. Thank you.
Thank you. Thank you very much for being brief. Really appreciate it. Now I give the floor to Joyce, and then Renata, you will have the last word before I round off.
Okay. Thank you so much, Anna, and thank you so much. And also thank you for these very good questions. I think most of the responses have been given. There's only that what it took to get that food on the table, or to get it to the diet. And this would mean also thinking about the trade-offs. What are the trade-offs to get a healthy diet? What does it mean for sustainability, for the environment and climate? What does it mean for women's workload? What does it mean for many other social issues, and even when it comes to the policies and the policies in place and enabling environment? So I think maybe the research, if we should also look at the trade-offs and see what does it really take to get the nutritious food on the table. And then in that case, then the decision can be made. How do we ensure that we can get a win-win as much as possible, and what measures should we use to make sure it is accessible to those who most need it and who are the most vulnerable? I think that would be very, very good, important information that we can add to help us define some of these information gaps that we see. Over.
Yeah, thank you very much. You spoke so fast that I hope our interpreters were able to get the gist of it. So Renata, I give you the floor. Your last pitch to us.
Thank you again so much, everybody. I guess as a conclusion, I think we should always remind ourselves that we will never end malnutrition unless we treat everybody fairly and also according to need, so as to ensure that even the most vulnerable and the poorest get what they need. 2020, and given the COVID-19 situation, should represent a turning point for nutrition. We need to keep investing, keep renewing and expanding the commitments, and also strengthening the accountability. This is the only way if we want to have healthier populations, more resilient populations, but also to avoid any reversal of gain, hard-earned gain. Thank you so much again.
Okay, thank you, Excellencies, ladies and gentlemen. I think we've all heard. I'm just going to put out some key things that stood out to me, okay? One of the things I heard was that inequity is holding us back. Very strong statement from Maria Helena Semedo. Inequity is holding us back. I heard from Renata, we will never end malnutrition unless everyone is treated fairly. And she emphasized that again. She also said we need to reform, not just food systems, also our health systems. These must go hand in hand. Seneca mentioned that we have inequalities in all aspects of the food systems. These are strong things that came out in the presentations. Now, I just want to highlight a few things. Some of the inequalities that sometimes we overlook but are so glaring to us. How can millions of family farmers who produce our nutritious food that we all need for healthy diets, how can they live in poverty and their children be malnourished? But that's what we see all over the globe. Farmers who are producing healthy diets, their children are malnourished and they are living in poverty. Clear example of inequity. We also saw how the poor cannot afford healthy diets. We've talked about this. The poor work long hours, and so they don't even have the time to produce these healthy foods, healthy diets for themselves. You know, in the midst of COVID, we have seen some of these problems. We've seen that the poor are in jobs where they cannot work from home. The poor cannot telework. So in the midst of COVID, they still have to go out and earn a living, and they are more likely to lose their jobs due to COVID. Then these are examples where we say COVID does not treat everyone equally. Now, because of the long hours they spend working and seeking jobs, they are forced to depend on highly processed cheap foods, okay? So they cannot afford. And because they cannot afford healthy diets, their exposure to poor diets, they are also exposed to obesity and non-communicable diseases like diabetes and heart diseases. And in the midst of COVID, they are more exposed to the likelihood of succumbing to the severe outcomes of COVID and also to death from COVID. So you see how we see this whole thing rolling and affecting the most vulnerable. So this inequity situation is quite serious and we must take it into our transformation that we are talking about. The food systems transformation called for would just be rhetorics if we do not address inequities that exist within them, the food systems and the health system. It shouldn't just be talk. We really have to put this into action. We cannot achieve addressing malnutrition with the inequities that we see in the system. Now, on this note, I think that I would like to just remind ourselves the promise we have made. We made this promise when we signed the Sustainable Development Goal. We said we will leave no one behind. Leaving no one behind means we must target the poor, the vulnerable, and look for long-term sustainable interventions. Long-term sustainable interventions, not surface interventions. And this means fair prices for their produce, fair wages, and better working conditions to protect their health. The people who put food on our table, they are working behind the scenes. We don't see them. look under the conditions under which they are working. We cannot talk about equity if we don't look at the working conditions of the poor who make sure that we get the nutritious food that we get. So on this note, I'd like to thank first our Deputy Director General, Ms. Semedo, for her opening remarks. I thank Dr. Renata Micha for her presentation, a very insightful presentation, and Stenike also for her insightful presentation. I want to thank our panelists, the CFS Chair, Ambassador Tiersen. I thank Lauren Landes, the Director of Nutrition of World Food Program, and Joyce Njero, the Lead Technical Specialist. Of course, I thank our interpreters who have worked with us so well. You know, sometimes we're running very fast, but they tried to catch up with us. Thank you very much for being patient with us. And sometimes we forget about ourselves. You've been great, our interpreters. We appreciate all the great work you're doing. I also want to thank all of you, our audience, for the great cooperation and the attention you have given to us on this presentation. I wish you all a good afternoon. Stay well and stay healthy. Thank you very much for being with us this afternoon. Thank you. Have a nice day. Bye-bye.
Yeah.
Thank you.
Bye.
Thank you very much,
Bye-bye.
Anna. Thank you.
Thank you. Bye-bye.
Thank you.
Bye.
Thank you. Bye-bye.
Thank you. Bye-bye.
Bye. Bye-bye. Bye to everybody.
Thank you. Bye-bye. Thank you.
Thank you all. Bye-bye.
Bye. Thank you. Excellent. Excellent.